Is there anything we can do to nutritionally to help prevent against a bad case of COVID if we get it? What should you do if you had COVID 9 months ago, but the symptoms still haven't gone away?
What we're doing with our patients, so and again, I prescribe it for my patients. So first and foremost, our patients, we recommend a minimally processed antioxidant-rich diet. So that's important, number one. Number two, I recommend my patients get outside on a regular basis as much as they can. Try to make it a minimum of an hour to 2 hours a day. I also try to have them do grounding. So I have them, get in their backyard. If they have a backyard, or go to a park, take the shoes off, lay on the grass, exercise outside in the grass, fresh air, sunshine. So antioxidant-rich diet and grounding. Now we have several protocols as prophylaxis for COVID-19. I have a lot of patients who are not indicated for the vaccine. So they're older people weren't studied, and many of them have immune compromising situations and the like. And so for various reasons, they were left out of the study. And so I don't consider them candidates based on the fact they were left out of the study primarily. So given that, we've placed them on high dose superfoods, antioxidants. We use a blue-green algae. We use a high dose liposomal vitamin C for our patients prophylactically. If they contract an upper respiratory tract infection, we'll use a grapefruit seed extract. We have a supplement that has quercetin with zinc. Of course, we use high amounts of vitamin D, especially if the vitamin D levels are low. That's a big demarcation as to who got sicker. With the ones who had lower vitamin D's got sicker. So we use vitamin D as an adjunct as well. Individuals who are at special risk, I'll write prescriptions for ivermectin prophylactically and also therapeutically in addition to the supplement. So this is the approach I'm using with my patients. And we've had a number of people contract coronavirus, and we've had them put them on a detox. There's one particular patient I treated with coronavirus. She had become ill, was vomiting, had fever, passed out, went to the emergency room, was positive, was very sick. We put her on the regimen I described above without the ivermectin, and within 4 hours of starting the grapefruit seed extract, quercetin, zinc, vitamin D, and blue-green algae, she was feeling better within 4 hours, and the next day she was completely back to normal. And we've had similar responses. I've had a group of patients who were about 10 days into it, so they were a little bit sicker. Some went to the emergency room and got steroids, but I put them on the same regimen, and they turned around. We use things like curcumin for the myalgias and pain, the headache. I don't recommend Tylenol. Tylenol reduces the acetaminophen, I'll say it this way. Acetaminophen reduces production of glutathione and probably has other anti-mitochondrial effects. And so we don't recommend that for pain and fever control. We use a concentrated liposomal curcumin in our regimen, and that's been very helpful for our patients.
What do you do to prevent dementia, Alzheimer's, and memory loss?
Yeah, those are challenging. I recently lost my dad to dementia in November of last year. Now, Dad was a chronic smoker, and we didn't get him off the cigarettes until his dementia was pretty advanced. Dementia, you get to a point where you're still cognitive enough to, say no, be taken seriously, although you don't remember things as well. So he was at that point where he was still doing doing all the, unhealthy things. And then he got pretty sick in 2018. I put him in the hospital. We were able to keep him on a plant-based diet. His dementia was advanced enough to where, he was more compliant with what we were recommending. So he stopped smoking and ate a plant-based diet. And we did improve his quality of life for a prolonged time until for a few years until he died. What I will say is dementia is such an aggressive disease, and dealing with brain function, you really want to catch these things very early. So early on, obviously, natural lifestyle, minimally processed plant-based diet is what we use, fresh air, sunshine, exercise. But also you want to exercise the brain. So we try to get our patients to do things that require cognition. So, crossword puzzles or something like that, but also exercise, and more specifically dance, exercise, and various things that require, coordination, your mind and your body. So if I was taking jazz dance lessons a few years ago, and I kind of go in and out of that. My jazz dance skills are horrible. I used to be, somewhat okay when I was in medical school. But when I was working with my private instructor, she would choreograph a routine, and I'm terrible at these choreographed routines. And so it took me a while to get it down. But I was thinking to myself, I'll work with this. So, this is an excellent way to, maintain excellent mental activity, is to dance and have to do complex steps, because it's forcing the brain and body to work together. And you build myelin when you use something. A piano player that practices piano all the time is building myelin to protect those neurons that control the fingers, et cetera. And so the more you're building myelin to protect, these areas that, with dance and coordination and that type of thing, the more you're improving your ability to function at a higher level at an older age. So what we're recommending for our patients, in addition to the lifestyle things, is that we're starting an on-site medically supervised exercise program. So we're going to get our trainer on board to start observing a patient, especially once as it gets warmer, to start doing medically supervised exercise where they're outdoors, number one, but doing high intensity, interval training, where she does a number of different exercises that brings about muscle and brain confusion. And so bringing about muscle and brain confusion helps tax the brain, tax the muscles at the same time. And you want to do this type of thing on a regular basis because you want to exercise those things. So instead of deteriorating the body with bad food and deteriorating the body by sitting indoors all the time around all this EMF, and deteriorating the body, without movement, you're going to improve this function, improve brain function, body function, by being out and exercising on a regular basis, because you're going to train these synapses. That's my theory. So that's our general approach to that.